Hi, I'm Dr. Kelly Starrett with H-Wave. One of my favorite applications of the H-Wave is working with people who have a history and diagnosis of osteoarthritis. They're not at a place where they can have surgery or they do anything about it, but they want to remain active and they need a solution to joint pain and they need a solution to potential swelling that results from those imperfect surfaces being loaded over and over again. Turns out that when we give our athletes and these populations we're working with H-Wave, they are very clever about the application. It's very easy to put one pad across the joint, right on the joint line, for example on the knee, and then turn on some high frequency. Give that person some on-demand pain relief because they don't have a really good solution to managing these degenerative changes or these sort of imperfect surfaces or these traumatic changes in these joints. So what ends up happening is that we tend to see that people are going to become less active or sort of be grumpy and see decreases in the quality of their life, or have to lean into some chronic anti-inflammatory use or even opiate use to help manage their pain. So what's nice about having H-Wave and thinking about H-Wave when we think OA is that this is a perfect way, again, for someone to be able to say, hey, I've overdone it on my knee, my joint surfaces aren't going to tolerate this, but I'm still going to go play my normal sports, do the things I want to do. Now we give someone a chance to sort of reset. We know that that joint surface isn't going to sort of respawn or regenerate, and that person may not be at a place, or there may not be good options for that person over the long haul, or certainly in the near future. So giving that person a chance of saying, hey, let's go ahead and give the brain a chance to experience less discomfort through the joint. Let's go ahead and kind of quiet that sensitization down, and then secondarily do a little pumping to manage any secondary swelling as well as loading those tissues. It's very, very powerful. And what oftentimes happens is that people can live very active, very full lives, even though they've got a hot spot or an arthritic joint, and they're not ready to have surgery or a joint replacement. So thinking OA and H-Wave, can join those things in your mind, and it's an incredible outcome solution for those athletes who want to stay active and those people who have OA at the same time.